conference is a national conference, and I would say it is a unique one, which we have called a unified action against communicable and non-communicable diseases. This conference is bringing together people from academia, from policy, from implementers, from district leadership. We are coming together as everybody in the country from diverse backgrounds to talk about science and to talk about evidence and to see how the science we do, the research we do, can inform the decisions we make. As you know, science drives development, it drives innovation, and we've never had a unique opportunity where all of us come together in one room. So that's why I say this is a very unique conference that brings together people from diverse backgrounds in the country. So we are all together in one room sharing science and seeing how that science can help us shape our policies, our health policies, shape our practice, shape the way we are doing things, so that we can get the best out of the research that we do. Traditionally, we as researchers in Uganda have focused largely on communicable diseases, HIV, malaria, TB, immunizable diseases. Those diseases kill a very big number of people. But we are now recognizing that there's an increasing prevalence of non-communicable diseases. For example, right now, if you look at a disease like hypertension, the prevalence in the community among adults is like 20%, whereas HIV is like 6 to 7%. So a non-communicable disease is even more prevalent than a communicable disease. So we think that we should pay as much attention to both communicable and non-communicable diseases because they interact and because both of them are very prevalent in the country. And of course, we cannot achieve the SDGs unless, we really pay attention to both communicable and non-communicable diseases. It is really timely that we talk about science and innovation and technology. We think and we hope that the people who are campaigning, they should make this as part of their manifesto or as part of their priorities for what they will do in case they come to power. Because, without science, without innovation, without technology, you can't have development, you can't create jobs, you can't move the country forward. So we are hoping that our holding the meeting at this point in time will attract some attention, to these type of issues as people talk about their manifestos and what they are going to do for the country. They should not forget about science, technology, and innovation. You cannot lead a sick population. When people are healthy, it drives development. And when we do research, when we produce evidence, that evidence informs our practice, and it informs, it leads to improvement of outcomes, health outcomes. And when you improve health outcomes, then you lead to a healthier population. A healthier population leads to a productive population. A sick population can't produce anything. We also appeal to people who would like to support us in one way or another in terms of money, in terms of any other logistics that are required for the meeting, we appeal to them to support us. This is a very important meeting for the country. So please register, come in big numbers. We are happy to have you at Munyonyo during the first week of November. The meeting specifically will start on the 3rd and end on the 7th of November.